want to start with just the brand story, understanding why I went from like healthcare to wanting to start a hair care brand. Tons of products on the market, and my main focus was really getting to a nitty gritty area within the healthcare space that really not being addressed all that much. At least it wasn't being addressed when I was starting the brand back in 2019. Had this idea, really wanted to bring concept to life, had no idea what to do. My hair had gone through like a roller coaster of emotions. Yes, my hair had its own emotions. It felt like it had a life of its own, doing what it wanted to do after I was put on all kinds of medications and hormone replacements after having issues with thyroid cancer and then fertility issues. Scalp health is really the center of our brand, and we're bringing products that truly address issues on scalp health, addressing issues on hair loss and thinning. My hair is like this. My mood's like this. My body's like this. And really finding the right products for my hair and my hair type while my hair is breaking off, it's thinning, it's shedding, it's splitting, it's doing what it wants to do, it's straight in the front, curly in the back, kinky on the sides. It was a mess. And not really able to find products to address my issues, my hair types. And at the time, there were more and more natural textured hair products on the market, but I didn't need just that. I needed things that really address my issues of what's going on with my scalp. What can balance me out? What can make my hair not so dry and brittle? And everything that I bought that claimed to be doing some of these things I thought it would do never really did. So I reached back into my own family history and started thinking about what we had been doing traditionally with herbal things. I'm from the South, originally from Alabama, and there's a lot of Southern deep root traditions that people don't really practice anymore. So I've got a cosmetic chemist and we started just working together. I feel like it was a match made in heaven, and we've just been creating formulations, really being unique about how we put ingredients together, just coming up with the whole brand line. I really wanted the brand to reflect me and my personality, my culture, my history, and my brand name, Yari Sáfo, which is Twi is a Ghanaian tongue that means healer or healing in some translations, and even messenger. I really wanted the name to reflect who I was and what my mission is in life, to be a messenger, to be a healer. And I wanted that to be reflected in the overarching name of the brand. And took the last four letters, Sáfo, which is a play on the word soft, manageable for me. And that was enough to give the name of the hair product Sáfo Hair. So it really has more of a deep meaning to me. The name coming from the continent of Africa, taking the last four words and really using that name to reflect what my mission in life is, even as a physician being a healer. So in addition, even the colors, the fonts, all of that has meaning and ties back to me. So even the terracotta red coloring that you'll see in a lot of our packaging even reminds me of that, the Southern Alabama red clay that some people may know about, that was very unique to the South and really takes me back to my own personal roots as far as I can trace back. Many of us may be from the continent of Africa. We have no idea where, but just having that connection in the name and then bringing those colors and that background into just the whole branding package really connected to this brand in a very special way. And some of the ingredients and herbal things that we bring into the formulations has some roots to me. I wanted to make sure that I was building a product and a brand that had ingredients that were true to my mission, even as a healer, that were natural, plant-based, reducing a lot of the hazardous, dangerous aspects. There are over 1,000 ingredients that we're allowed to use here in the US that have been banned in the EU. And a lot of those were starting to relate to or correlate with uterine cancers, fibroids, and some of them may even have effects on reproductive health. Studies out of Harvard School of Public Health are even showing that most of these products have a higher propensity to be sold in Black and Brown communities, which is unfortunate, right? Because we already have these health disparities and poor health outcomes. And then you throw these consumer goods that increase our health risk on top of that, and products that we need to use to look professional in the work setting. We have to use them. And then these hair straighteners, which, years ago was part of this European beauty-centric ideas around your hair has to be straight to be beautiful, that they're finding are leading to uterine cancer. So a lot of these products that are sold in higher densities in the Black and Brown communities, I wanted to make sure that I'm building a brand that is safe and quality, plant-based, and improve access to products to these communities as well. I am focused on making sure that we're bringing and incorporating natural plant-based, high quality ingredients to our products. And we are sourcing ingredients that are indigenous to South America, the Amazon region, certain countries on the continent of Africa. We also source ingredients that are native to the Mediterranean area and even India. So we have been very intentional about how we are sourcing ingredients, how we're formulating those ingredients and bringing them together. Scalp health is really the center of our brand, and we want to make sure that we're bringing products that truly address issues on scalp health, addressing issues on hair loss and thinning, because that was one of the major issues I was having around hair loss and thinning, and not really finding products that were addressing that. Most of the products are targeted to those young, vibrant, vivacious young 20-year-olds, and finding a brand that really would focus on like issues I was having, like hair loss and thinning, which a lot of times people are embarrassed to really have those conversations and talk about. So bringing those natural aspects where I'm not having to use chemicals and medications to really improve the health of my scalp, reducing itching, reducing dandruff. We also have products that help with like excessive flaking, and some people may be diagnosed with seborrheic dermatitis. And also issues addressed in a natural way, the male pattern balding and those hormonal issues that will result in those balding. We see a lot of balding with postpartum in the postpartum phase after pregnancy, and all of this is related to hormonal changes. And we wanted to be able to bring these natural plant-based ingredient products that address a lot of this. In addition to that, we wanted to make sure that we're also bringing products that maintain healthy hair so that you're not shedding. Hair loss is not just at the scalp, which we really want to make sure that people are getting back to their roots and recognizing how your scalp really plays a huge role in how your the health of your hair overall, but it also breaks off at the shafts as well. So you're having issues of breakage and split ends. Of course, once it's split and broken, there's not a whole lot to do about it, but we want to make sure that we're bringing products that are preventing further damage using ingredients like mushroom extracts, amla, fenugreek. We're using hemp CBD in some of our products. We use a lot of honey and avocados. We are intentional about the formulations and make sure that they're actually delivering and giving the consumers the results that they're looking for. As you start to have those issues with hair loss and thinning, and it's not just men, women have it as well, especially as they age or if they go through certain life events. Stress plays a big role in that. We start to see this thinning of the hair, which oftentimes affects how we show up in the world. We tend to dim our light sometimes when our appearance on the outside starts to change. And oftentimes we feel a little hopeless. There's no way that we can address the issue. There's no help. This is just what's going to happen. But I think understanding the root cause of the hair loss and also having products where you feel good about using, as you start to see these changes, it contributes to social anxiety. You're not showing up in social settings the same way. And people who are dating, how you show up and date, and even what causes depression in a lot of people. So we want to make sure that we're also highlighting how your hair isn't just a thing of vanity, but also affects your mental health and how you show up to work, how you show up in social settings, and how you interact with people. How you feel impacts how you show up and interact with other people. The other component to this is how we don't think about what's happening inside of our bodies and how it shows up in our hair and our scalp. So, for instance, you have diabetes, we oftentimes start to think, I'm getting old, I'm taking these medications, your hair starts changing. A lot of people will start to wear wigs and try to supplement in other ways, not realizing maybe my glucose or my sugar is off and it's causing my hair to change. It's causing my hair to be more brittle. It's causing my hair to be thinner. And that's the one thing I think that we don't correlate with when there starts to be changes in our hair and our scalp. We don't oftentimes go seek medical attention. Why is this happening to me? Maybe you're going into premenopausal or perimenopausal phases. Maybe it's something else going on with your thyroid or your diabetes. And diabetes is also hormonal as well. It regulates with your glucose and how your glucose is regulated. So we don't think about that, and we want to make sure that we're bringing more attention and light to these conversations around people's overall health and how things inside the body oftentimes will present and show up in our hair and our scalp first. But in addition, even the medications we take, like I never have these conversations with my patients. I'm going to give you this blood pressure medication, or I'm going to give you this medication, and it may cause some hair loss and thinning. It may cause these changes because these are things that we're typically taught. We're not there to teach you how to do your hair in medicine. So oftentimes these medications can have side effects that we aren't told. So oftentimes if you're starting a medication and you start to see these changes, it may be a good idea to talk to your healthcare provider as well, because there may be some changes that they can make to your medications. These are all things that we bring to the brand, start to highlight and educate other people, but want to make sure that we're bringing the right lifestyle, the right vibes, the right products to market, and people can really connect with our brand in one way or the other.